All right, everybody. How are you? Dr. Fedich here, Village Family Clinic. Hopefully, you're all tuning in. I'll give everyone just another little minute here to settle in. Hopefully, we are all there getting ready for this cool presentation. So, no free presentation, Desk Warriors, your guide to pain-free work. So, we know we do a lot of work from home nowadays, and this is just working at home as well. This is just general workplace environment stuff. We're going to do some stuff work from home. But this applies obviously to desk jobs as well. So we're just going to start just another second here. Got a pen and paper and go over some cool stuff. This isn't just theory and things like that. This is real stuff that we do in our workplace every day. Hopefully, I hit the record button on this, and we'll get a recording out to everyone as well. If you couldn't make it, I know it's kind of a awkward time of day with the work from home. Another thing is everyone's got different schedules, so it's hard to kind of schedule these things in between our hours here and everyone there. So any suggestions on times work better for you? We're open to that as well. So let's get another second here. We get started, but hopefully everyone got a pad and paper. We're going to get out talking about how to keep a desk-free, our desk a pain-free zone. So one of the most common injuries you see here in the clinic are repetitive stress injuries. So people think of injuries, things like car accidents, falls, broken bones, and we certainly do treat not broken bones, but car accidents. I treated 3 or 4 this morning. But what we really see mostly in this modern workforce is repetitive stress injuries. So doing the same thing over and over again, typing, working at a desk, or even things like slicing and those kind of thing. And we see much more repetitive stress injuries. So patients often come in, I don't hurt my back, I didn't do anything crazy, I didn't get in a car wreck or anything else. It's not usually that, especially in this modern day. It's sitting the wrong way at our desk for hours and hours. I just had a new patient this morning commuting to Newark back and forth and sitting all day. So we're sitting 10 hours, we're in a car. So that's what a repetitive stress injury is. It's not the big thing. It's not the big fall. And that's really not what we see nowadays. It's more these RSI, repetitive stress injuries, where it's doing the same thing over and over again that's causing these injuries. So that's what we're talking about today. This is going to be some real practical stuff. I'm going to give you guys real stretches you can do at home, how to set up your workstation. This isn't just talk or theory. It's to be real active stuff for you to do. And hopefully you find it all very helpful. So just give this another minute or two to get everyone on here. See some more people signing in now. So I appreciate y'all joining us for this cool free Zoominar. All right, so we'll get going here. And so my story, so most people on here are patients, but if you're not a patient and you're hearing this or a friend passed along, and of course share this with your friends and family, so hopefully get the recording out. A little bit about myself. I was born and raised right up the street here in Mount Olive, New Jersey. If you're not a patient, you don't know that I'm 6'5", so I played a lot of basketball, a lot of sports when I was younger. We were driving from Mount Olive, New Jersey to a family wedding up in upstate New York. Someone ran a stop sign, hit our car, put the 4 of us in the hospital, my mom, dad, and brother in the hospital. Concussions, broken ribs, some punctured lungs, those types of things. Those things were pretty good. Most of us not too many lingering effects, but I had a pretty bad back injury. The car hit on my side, basically right where I was sitting in the back seat. And I would come home from school after being in school all day, and I remember just laying on the floor for hours, not able to move after a day of school. Couldn't play basketball, couldn't do much of anything. Nobody's really helping me. Saw the medical docs. And my grandmother had actually seen a chiropractor for some issues, literally probably 80 years ago. And, my mom decides to take me to a chiropractor. Next thing you know, I'm back up and better. Just a couple weeks after suffering for months this back injury. We happened to have a career paper due at school. And I thought my dad's job was pretty boring. He was an engineer, so I didn't want to do that. And the chiropractor just helped me. I thought it was the coolest thing. I went and shadowed him for a day. And I was 13 years old and said, I'm going to do this for the rest of my life and help people the way that I was helped. And so far, it's on track. We're just about to hit our 22nd year in practice. March will be 22 years we've been open here in Hackettstown, Alamucci area. Those of you who know, we were across the street at Panther Valley for about 10 years, the Panther Valley Mall. We've been at our current location, about 12 right now that we're hitting March for our anniversary of 22 years. 2004, we opened up. So I've been here for a long time. This is one of my books. So I have several books. If you're a patient, you've definitely been seen this. There's letting someone in the waiting room there. If you in one of our books, we've seen this before. This is my best-selling book. Yes, you can live a pain-free life. If you don't have a copy of that, let me know. And there's my wife and kids. If you don't know, most people know a little bit about me, but just give a little background story. My wife and I have been married for 13 years, 14 years. Those are our lovely kids. Scarlett is my daughter. She's 10, about to be 11, also about to be 16. If you have middle school girls, you know what I'm talking about. And little guy's my son, Britton. He is 7. He'll be 8 in a couple months, and he is in 2nd grade. Scarlett's a golf maniac, loves golf. I've never seen a little girl like golf so much. And my son is a boy's boy. He's basketball, baseball, and football, and all that kind of boy stuff. So that's the family there. All right, so now we're getting into the presentation there. So ergonomics is what this is all about. If you don't know that word, it's the word ergo is a Greek word, like a lot of our words in our family. It's really the study of the human interaction with the workplace. So ergo just means work, and we're studying the interaction of the workplace. Ergonomics means to study how people get sick or injured at work and how we correct those problems. So a lot of people get injured at work. Like I said, it's really much more common to have people sitting at a desk having back pain than it is to have people that are injured in a car wreck or falls, broken bones, and those types of things. So we're going to talk about that today. So I want to know, obviously can't talk to you all through Zoom, but what problems are you having? Think about it now. Are you having some neck pain, neck stiffness, lower back pain, wrist injuries, all those kind of things? Can be really, really imperative to get better. And what's going to cause those problems? So we're going to go through this all today. Location, where's your workplace? And again, this is kind of a little bit about working from home, as a lot of people are. Where are we working? I hear every day in the office, I'm working from my bed, those kind of things. We're working on a couch. To where we're working in the house or at the office, kind of equipment you're using. That's one downside of work from home. A lot of people aren't equipped as well as a corporate office setting. So maybe we're on a laptop on the table, and don't have the right setup. What are we doing? What kind of activity are we doing on the computer? Some people are using mouse a lot, some people typing a lot. There's other work from home jobs as well that could be affecting you. What are we doing? What kind of project? What kind of season is? Right now, this is the coldest 6-8 weeks it's been in New Jersey in pretty much my whole life, or maybe since the 90s. So the cold is making people tight. We've been very busy. People tight, stiff muscles. These are cold room you're in. I've had patients work from home in their closet, in their bedroom, in their all kinds of crazy stuff. So that can really affect it as well. So we want to think about all those things. And what are we doing about it? So hopefully we've done something about it on your own, or you've seen us for it, or something else, but we're going to talk about all that today. All right, so office ergonomics. So some things, big typing is one of the big things. Obviously, a lot of people are typing a lot of times on typing. We're using data entry typing, so a lot of repetitive motion with their hands. Telephone is another big thing. We see a lot of people with the phone in between their neck like this, doing this kind of thing with their phone. We're going to talk about that. Or even holding it up with their arm for hours on end, causing problems that way as well. Sitting, how we sit is really, really important. We're going to get real into detail on that. The position we're in, the proper seating position. The amount of workers sitting for 8 hours a day. A lot of people are commuting an hour or two a day, so we're sitting. Then we're sitting on the couch watching Netflix and chilling at night. So all this sitting, if we're in an improper position, can really be detrimental to our spine. I know, you guys are patients, I'm up and down. I'm running around here all day pretty much. My back gets tight when I go to a conference. I'm sitting. I was just out one a couple weeks ago. You're sitting in the hotel conference chair for 8 hours. That makes my back tighten up. I can adjust people all day, every day. It doesn't bother me, but sitting all day really was. So we're going to keep mentioning this repetitive stress injury thing. So it's small repetitive motions over a short time create stress, injury to the tissue, and that's repetitive stress injury. So again, here in the office, I did treat 4 car accident patients so far today, but much more often, people, I don't know what happened. Nothing happened. My back's in tighter. Now I can barely walk on my neck, shoulder. And it's all those small repetitive motions over time are causing really the majority of injuries that we see in modern society today. So some areas that we're going to be talking about where we see these injuries are most common. The fingers and the thumb are going to be really common. So everyone's heard about carpal tunnel. We're going to talk about that. Hand and wrist injuries, arm, shoulder, head, neck, upper back. So we see this little drawing over here. Whoops. Let's get back to there. There's a little drawing over here with this guy's arm here. So there's 2 main nerves running through the upper extremity. Got our median nerve, that's going to do these 3 fingers. So probably at least every day in the office, people tell me they have carpal tunnel syndrome and they have numbness on this side or they have numbness somewhere else. So the median nerve is the nerve that does the carpal tunnel right through there, and that's these 3 fingers only. So if you have numbness anywhere else, it's not carpal tunnel. That's the only place you can go. And if it's more than that, so it could be those 3 fingers, but if it's going up and down the arm or the other fingers, it's also not carpal tunnel. The other side of the arm, you're going to see there's the ulnar nerve that goes kind of on the pinky side. That's going to do the last 2 fingers. And that doesn't go through the carpal tunnel, so that's a different situation there. So that's just one thing. Probably 3/4 of the time when people think they have carpal tunnel, it's not. It's a neck, shoulder injury, or it's a different nerve issue. You could be entrapped at the elbow or the shoulder. So it's really important to evaluate all that. I'd say, like I said, most people that think they have carpal tunnel don't. It's something else going on. Main anatomy over on the right, we want to talk about are joints, ligaments, tendons, muscles, and nerves. So the joints where 2 bones meet together, we call that a joint. This is just a good anatomy lesson for you. Ligaments are going to be what hold those 2 joints together. So we got 2 bones, ligaments, the rubber band that holds it together. A tendon is where a muscle goes into the bone. So the bicep muscle inserts into the bone there. That's called a tendon. It looks very similar to a ligament as well. It's kind of a rubber band. Muscles, I think most people know what that is. That's the big red things that move stuff. And the nerves are what control all this stuff. So mostly a nerve's going to fire. It's going to tell the muscle to move. Muscle's going to pull a tendon, which is going to move a joint. So none of this will work without the nerves working properly. So just a little quick anatomy lesson for you. All right, so what are some symptoms we're having a repetitive stress injury? One of the main ones is pain, obviously, but it's not the only one. So people think they're on pain or a problem. They often say pain is the kind of last thing to appear and the first thing to disappear when there's a problem. So typically things have to get pretty bad before we have any pain. So people tell me I don't have any pain, it must be fine. And some of the other knowledge give people, I was at the dentist Tuesday, luckily all clear, no cavities, but everybody's been to the dentist. Nothing hurts. Your mouth feels great. You got 3 cavities or you got some other dental problem, right? We've all been through that. And nobody ever tell the dentist, let's wait till that tooth rots out and then we'll fix it. You fix that cavity before it becomes painful. And they can be pretty bad before they're painful, dentists will tell you. Same thing with the rest of your body, right? You can have some pretty bad problems. We've also all heard of somebody who ran marathons or was a competitive athlete and they dropped out of a heart attack or something terrible like that. And I hear that every day here. So pain's often the last symptom. Some of the pains we're looking at, and sometimes I annoy people, I think, a little bit asking what the pain feels like. But it's really important for doctors. We can tell what's causing the pain by what type of pain it is. I know this can be really hard when you're in pain to describe, and like I said, it can be annoying to ask you about it, but it's really important. So aches are typically going to be muscles. So if we tell we're achy, sore, that's muscular pain, maybe a little arthritis, throbs as well. Sharp burning pains are usually more either joint or nerve issues, like burning, numbness, tingling, like those next ones. Those are typically a nerve problem. So numbness, tingling is nerve, especially like the top ache, throb versus numbness, tingling. Those top ones are going to be more muscular or joint issues, where numbness, tingling is going to be a nerve issue. So, as doctors really want to know which one's causing it, because that's really important to diagnose and figure it out for you. Other things, temperature change sensitivity, especially in the hands. A lot of people have trouble with the cold temperature sensitivity, especially these colder temperatures. So that can be another symptom. Loss of strength or coordination. So with carpal tunnel or some of these repetitive stretch injuries, we'll test the muscle strength. We'll be a little weaker on one side than the other. And that can be no pain, no tingling, no numbness. We're just losing some strength because there may be some nerve compression in there. And fatigue as well. So fatigue, we're getting tired at the end of the day, the back's getting sore, eyes tired, neck's tired, that kind of stuff can be a problem as well. All right, so what conditions are we talking about with RSI? So remember RSI is repetitive stress injuries. So some of the things we're going to see, tendonitis, good examples of that, a golfer's elbow or tennis elbow. You can see me on the screen here. Golfer's elbow is going to be on the outside of the elbow, or tennis elbow is going to be on the inside. Oh, actually, I said that wrong. Sorry. Tennis elbow's out here. Golfer's elbow's on the inside there. And that's just repetitive use of the same muscle. We call it tennis elbow from doing this with the tennis racket. Golfers are coming inside, so they're going to put the pressure on the inside. So those are real comes tendonitis. Of course, there's 100 other ones. Carpal tunnel syndrome, again, it is common, but it's much more overdiagnosed, or people think they have them, they don't. Just really make sure where that tingling is coming from. But you see that picture there, that little angry nerve in there. There's a small tunnel in there. All the tendons for the hand. So when you grasp your hand like this, the muscles are all the way in here, and those tendons got to wrap through there and cause that movement. And unfortunately, the carpal tunnel is there. It's a small tunnel, and there's a little nerve in there, that median nerve we talked about earlier. And if that's getting pinched in there, we get numbness, tingling in these 3 fingers. More common things we see is muscle spasms, trigger points, which are just big knots in the muscle. Sometimes you might feel me pushing on some pressure points in your spine, and those are trigger points we're trying to work on. Fibromyalgia is kind of a chronic pain syndrome that can happen. Headaches are probably one of the most common repetitive stress injuries. 9 out of 10 headaches are coming out of the neck. That's a tension type headache. We're leaning forward on the computer screen, doing this too much, causing tension in the neck, causing a tension type headache. Neck pain, again, especially posterior in the back of the head. Neck pain is going to cause some problems. And fatigue, whether muscle fatigue or just general fatigue, can be an issue as well. All right, so how are we going to fight these repetitive stress injuries or workplace injuries? We're going to want to type properly, type it on the computer, proper positions. We're going to talk about taking lots of breaks. So it's really important to take some breaks. A lot of you work from home 6, 8, 10 hours straight, and they're not doing any breaks, which is we're going to talk about that. Good ergonomics at our workstation, and some stretches. So we're going to go through all these points individually and help you fight any kind of repetitive stress injuries you might be dealing with, or any friends. All right, so we're going to type it properly. So we're going to have some pictures here in a minute. We want everything in alignment. So we're going to show some pictures to be much easier. Monitor, keyboard, and copy stand all in line. A lot of people do some funny things with the monitors. This will be much easier once I show you. Neutral wrist angle. So your wrist, a lot of people have it pointing up or pointing down when they're typing. Neutral is actually a little bit like this. So we're not up, we're not down, we're not straight. It's slightly flexed. That's neutral wrist angle. We're going to talk about all the angles in a second. Stop the contortions. A lot of people have a monitor on one side. They're twisting for the keypad over here. The mouse is over here. That's what we call contortion. So we don't want to be doing that. We're going to listen to your pain, keep changing, and break any bad habits. So we're going to actually go through some pictures here and really show you what we're talking about. This is something hard to just talk about. So we're talking about breaks, talking breaks. So here's a real simple rule. People want to know how to take breaks. So how long you can go without symptoms? So we're going to just track it, get your phone out, or just clock, whatever. Whenever you have symptoms, say, my neck starts hurting after 45 minutes, or in this example down here, it's 67 minutes. So, I start getting some neck pain headaches after 67 minutes. So what I do is find that timeout, try it a couple times, then you're going to take 10 minutes off that, and then that's your max work time before you take a break. So if it's 67 minutes, so your neck starts bothering you, just take 10 minutes off there. That's 57 minutes between breaks. And that's the most you want to go. We don't want to go any longer than that. I know a lot of people tell me they can't do that. They can't take a break. And a break doesn't mean to be you turn your computer off, you leave the house, and you go for a 45-minute jog or something like that. It just means take a break from your workstation. So this can be just as simple as, putting all the keyboard down for a minute, taking a walk around the room, take a bathroom break, do a little stretch, which we're going to show you in a minute. It doesn't need to be a whole big, break. You're not turning your screen off for 45 minutes, getting in trouble at work. So that's a good rule, 10 minutes before the first symptom. Again, your productivity doesn't suffer. There's a million studies on this. I was just actually a seminar aimed at doctors, and they said you should not see patients for more than 3 or 4 hours straight. Your productivity will suffer. You're not as sharp. You're not thinking as much. Your brain needs a break. And to really not see patients more than 4 hours without a break. And work is the same thing. So pain's going to kill productivity. You'll find you take these breaks, you'll get more done in an 8-hour day with 4 or 5 breaks than you will in an 8-hour day with no breaks. You'll actually get more work done even taking those little 10-minute breaks once an hour. So pain's going to kill your productivity, not the breaks. I assure you that is true. All right. All right, so we're going to go through the comfort review sheet in a second. These are actually developed, a lot of these are some old pictures, but there was a really good program they did it with a reservation agent. It's really pretty neat. We're showing adjusting your workstation, give you some stretches to do. There's real stretching here to do, how to relax your neck, back, hands, and wrists. So here we go. So proper equipment, we're going to show you some pictures. The desk, the right height, the depth and configuration, your chair, a back support is really important on the chair. You want armrests on a chair as well. So we're going to show you pictures in a minute. The right keyboard. A lot of times, if you're on a laptop a lot, having a separate keyboard can be really helpful. Monitor or your screen height, we're going to show you that, and any kind of stand that you might be doing. So we're going to show you some pictures to really show you how this works. So here we go. So this is an old picture. I know this is a good program. This is Alaska Airlines did a big study on this, still one of the biggest studies on this. So this picture kind of tells you everything. I know that's an old monitor there, but so the monitor height, I see this is probably one of the biggest things I'm telling people. Your eye should be level with the screen, but looking slightly down. So I've had patients, the monitor is above eye level, even with eye level is a problem, and too low is a problem. So in this picture, I like about 15 degrees below. So if we're eye level with our screen, we want the screen about 15 degrees down. I think humans are designed to walk, and we're looking in front of us all the time, so we're not tripping over something, we're not seeing something. So we're designed to naturally have a little bit downward gaze. So even at straight ahead, the monitor's a little high. We want about 15 degrees down. You're gonna see this woman here is in a really good posture. We want everything at 90 degrees. See her elbows to her wrists are about 90 degrees there. That neutral wrist angle we talked about. So we don't want the wrist totally flat. We don't want to flex. We don't want it, or that's extended. We don't want to flex. We want it just a little bit flex, that little flex to that wrist. That's where sometimes those little wrist pads come in handy. You sometimes do without it, but we want a little flexion in those wrists to keep that carpal tunnel open. So you see your shoulders are up straight. You're going to see her ear over her shoulder. This is a posture thing that is good just in general life. I'm always telling patients about this. The ear should line directly over the shoulder there. The shoulder down to the elbow is pretty even. You see the elbows forward just a little bit. And then we have that neutral wrist angle. So that's that way down. We want a back support. You can see she has a nice back support there. Some chairs have no lumbar support. That's a little part that kind of curves in on your lower back. That's really important to have. Thighs level with your knees. That's what they're showing you down there. So the thighs level with your knees. This is a huge one for the lower back. And I'm telling patients about this for their cars as well. So all this kind of applies for your car. Your knee should be at level with your hip or even higher. And 9 times out of 10, that angle is down. So the knee should be at level with the hip or even up a little bit. So you can see, people say, oh, my desk doesn't work that way. You can see what this woman did in that picture. She's got a little footrest there. You can also take a little towel, roll it up, and put it underneath your knees to elevate it. If you have a lower back issue, I actually like the knee above the hip. So you can see, like I said, she's flat. I would put that knee up a little bit if you have a back issue. And that's a good trick for your car, too. I probably saved, 1,000 patients with this. They're doing long car rides, their back hurts, they commute a lot. Having the knee above the hip takes a lot of pressure off the lower back. If you are in a car, since we're talking about it, I would have we don't want to be quite that upright. I tell patients in the car, start off your car seat at about 90 degrees. Let me get this camera here. We want to be about 90, and then we'll back the seat to about 100, 110, and then elevate the knees a little bit. So that's ideal for a car. Again, a little different here. So you can see, again, we're all straight elbows, shoulders, ears, hip in that straight line. Knees about even, maybe a little bit up if you have a lower back issue. In a way, if that doesn't work, a little footstool here. You don't need a footstool, get a box. Anything you got laying around the house, you got something laying around the house that can do that. So this picture tells 1,000 things. This is everything you need to know right here, just in this picture. Eyes a little bit looking down. We want about 15-degree downward angle looking at our monitors. And arms relaxed. We want the neutral wrist angle. Hips, shoulders, ears, all in a straight alignment. Knees and hips either in alignment or knee up a little bit. If you do have some back issues, I do like that for patients with lower back pain. Nice lumbar support there as well. So this might be a simple old picture. Again, this is one of the biggest ergonomic studies ever did by Alaska Airlines. They did a huge ergonomic study years ago, and that's why this picture looks kind of old. But this is everything you need to know about ergonomics in this picture. Really good picture for you. All right, so now we're going to get some exercises. So if you're sitting and you can do these, that's cool. And this is stuff, other people tell me, I don't have time, I can't get up, I don't have a foam roller, I don't have rubber bands at home, the stretchy bands. This is all stuff you do at a workstation. So we talked about your breaks earlier. And again, that's 67 minutes. At 10 minutes, you take a stretch break. So that's 57 minutes. This will take 2 minutes. All right, not even. So everybody can do this. So we're just going to really stand up nice and straight. And you see the woman in the picture. We're just going to bring our ears up to our shoulders. You feel a tension, hold for a couple seconds, release, bring down. There's 3 sets of that. Right? We're just going to get some of that tension out of the shoulders. Real easy. This is all real easy stuff, right? All right, next one, back arch. So we're going to lock our hands behind our head. We're going to lean back over the chair. My chair doesn't have back. I'm on a doctor's stool, so I can't lean back too far. We're going to stretch that back, gently relax, and repeat that 3 times. So we're all stuck like this, sitting over there, and we just want to bring that back a couple times a day. All right, so that's a real easy one. Yeah, like I said, people say, I don't have a roller, I don't have bands, I don't have this. This is easy. This was a huge study on ergonomics. That's why these pictures are old, but it's still like the definitive study on this stuff. All right, shoulder press. So this one we can do standing, or you can kind of do it in the seat if you don't have it. We'll lock our hands behind our back. If we have any shoulder problems, we're not going to do this. You have some shoulder issues, joint issues, don't be doing this one, but most of us, this is fine. Lock our hands behind our back, pull our shoulder blades back and down, stick your chest out a little bit, hold, relax, and breathe. All right, so we're trying to get those shoulders back and down where they're supposed to be because we're all hunched over like this. So this is when you stand up real quick, lock your hands behind the back, shoulder blades together, hold, relax, and repeat 3 sets. Very easy. All right, wing spread. This one's very similar to the back one. We're just going to lock our hands behind, try to pull our elbows back as far as we can. All right, so again, everything modern society is getting worse. This was done a while ago, as you can tell by the pictures. It's getting worse. We're on iPhones, iPads, phones, computers. Everything's flexed in front of us. We're all crunched over. And another side note on this, I was at another seminar last year, and we all know this is bad for your neck, back, all that stuff. What they're finding now in this modern work from home environment and all this stuff with the bad posture is your aches and pains are kind of the least of the worries. They're actually finding decreased heart and lung function with patients slunched over a desk all day. You're compressing your heart and lungs all day, and they're finding increased risk of heart attacks, lung problems, very serious stuff from being all hunched over all day. So we're not meant to be all scrunched over like that. So this will help push you back. So it's not really just the aches and pains. As I said, they're showing some pretty serious problems with people sitting all day in these bad postures. So another real easy one. Again, I made these easy. Don't want too much problems doing this at work. Next stretch. So we're not rolling the head. You can see this picture. We're just going to ear to shoulder. We're going to go repeat each side to each side. Just bring it down each side. We're going to slowly stretch it. If you want to do a little overpressure, bring your hand up and over. Pull that down. Your hand up and over, pull and hold just a couple seconds. We're not rolling. We're just going sideways, ear to shoulder. That'll feel really good. Any of you on a workstation, these are just good, easy stretches. These are just made to be real easy at a workstation that you don't have to get up. You don't need bands. You don't need anything. Just do them while you're sitting at work, and it's a real quick routine. So real easy neck stretch for you. All right, sitting twist. So low back's going to get tight sitting all day. Going to keep our knees facing forward like you see the woman in the picture there. Arm rest is really good to just hold on to and turn. All right, we're just going to turn, hold for about 8 seconds, do each side a couple times. So we want to keep our lower half of the body stable so your rear end, legs, feet are staying there. You're just twisting the top half of the body like the woman in the picture there. So just a gentle sitting twist. You might hear a pop or click here once in a while. That's okay as long as it doesn't hurt. It does call us, but just nice and gentle twist. Get that lower spine twisting. We're sitting all day in the same position. All right, next, wrist press. Some people call this prayer sign. So this is good for carpal tunnel syndrome or any kind of neck. So our hands are stuck like this all day. We're just going to put our hands together in a prayer style, and we're just going to press and hold this 8, 10 seconds, 2, 3 times. Now, this is also a test for carpal tunnel syndrome. So if you do this and your fingers start burning, tingling, these 3 fingers, that might actually be carpal tunnel. If you think you have carpal tunnel and you can do this, you don't have carpal tunnel, I promise you. So we're just doing this little prayer test. Get those wrists stretched out. Nice straight line. Like you see that woman, her wrists and elbows are in a line, and getting those wrists stretched out for you in a prayer type stretch. All right, we're going to do a reverse wrist press. So we're just flipping them over this way, repeating the same thing. So I want to make sure we stretch them both ways. They kind of get stuck type in that same position. So we're just going to do the prayer, reverse wrist press, get them stretched out again, just 3 times, 8, 10 seconds. Hold those. Get a nice stretch in those wrists. All right, get a grip. So we're going to sit at our desk and our chair. We're going to take the edges. Hopefully, you got a nice squishy chair like you see this one in this picture. We're going to grab this. Just give a good squeeze, hold for 10 seconds. We're trying to activate some of those small muscles. We're stuck in that same position. So we're just going to stand up nice and tall and straight, grip the side of the chairs, hold it for a couple seconds, and do 10 sets of those. So hopefully you got a nice foam chair like that, but you can just grab whatever. Squishy balls are good too. But again, we want to make this. There's no excuses. Everybody's out of desk chair or somewhere to sit and do this. So we're just going to do that little grip stretch there. And those are stretching routines. So that is really, really easy. We can all do that at home. There's no excuse not to be able to do that. A really easy routine. So we're going to take our breaks. Went over our workstation really carefully. So how we set up our workstation is incredibly important, really important. So first, best and easiest thing is always what I tell people to do. People ask me what's the best exercise or the best stretch. It's the one that you're going to do, right? So the first best and easiest thing to do, maybe you looked at that, you know what, my monitor's too high, I got to lower it, or my knees are below my hips. That's a big one when you have low back problem. That'll change your life. You get the knee equal or above your hips, back's going to feel 10 times better working during the day. Same with the car seat. I'm telling you, any kind of low back pain, or you know anybody, that's the easiest trick. And if you look around, 99% of people, the knee is below the hip, equal or above, especially in your car seat. Go check your car seat today. It's one easy thing you can do. Go check your car seat. 8 out of 10 people, that knee is below the hip. Get the knee above the hip or equal to the hip. You're going to feel much better. The monitor height, the wrist angles, all that stuff, really important. A lot of people too on that workstation we kind of talk about, we're sitting too far from our computer. So we saw that 90-degree, a lot of times just pulling closer to it is going to make a big difference too. So we're looking for some change. Not all change is going to work. We want to keep changing. We don't want to cripple our efforts. Any problems, obviously talk to me, or if you're at a company, HR, just have paperwork on my desk got to do for a standing desk for a person. So those kind of things as well. All right, so here's some other things here. We're looking at a cervical spine x-ray or a neck. Looking at the one on the left, it says normal. On my left, I see a nice vertebrae there with nice space in between them. That's what our spine should look like. We're all supposed to have a natural curve. So our neck from the side should curve backwards a little bit. That's the proper neck position. We're sitting slunched over a while. Our neck gets stuck forward. You see how that neck's kind of straightened out over there instead of the curve? Now, if we do that for too long, we'll get what this picture is. And you see those vertebrae that are circled in the red, they start getting worn out. You see those vertebrae look kind of rough around the edges. I tell people think of like stalactites and stalagmites on caves. They're getting those growths going out. And unfortunately, what comes out in between those vertebrae are nerves. So 9 times out of 10, those nerves are getting pinched in there from that. Years of having that bad neck posture has put pressure on the spine. We're flattening them the curve, and we're getting pinched nerves in the neck. And that's something we can obviously help you out here at Village Family Clinic. Oops, we got ahead of ourselves there. All right, so here's what we want to do. We want to change our bad habits. A lot of stuff you can fix at home. Be surprised some of those little things we talked about. You start doing that, it can really relieve you out of pain. We talked about our stretches. We went through a stretching routine. Again, I'll try to get you this video if it recorded, and you can see this as well. The breaks we talked about are really important. People tell me they can't take breaks. I'm telling you, it's those little breaks. You get more work done throughout the day, short breaks. You just need a couple minutes to do those stretches we talked about. If you're having some problems, your options are drugs and surgery. A lot of people say, that's not too bad. I take 4, 5, 6 a leave a day, and I can get through the day. Obviously, that's going to give you some problems. I just did another continuing ed class a couple weeks ago, and they said the number one cause of liver failure in America, it's not drinking, it's not anything you think about. It's actually a Tylenol. So Tylenol is the number one reason for liver failure in the country. All the alcoholics and all that stuff doesn't compare to Tylenol. So you don't want to take too much of that if you can avoid it. Obviously, chiropractic's here for you. We're here for you to stay in the job. Not to go to the chiropractor, miss less work than people who go to other kind of doctors for these problems. Obviously, no side effects. Worst case, you go to the chiropractor. Maybe it didn't work. It works, 90% of the time, not 100. usually get people back to work fast and miss less work. If you get back surgery, you out of work for 6 months or a year. Same with shoulders, knees are out 6 to 8 weeks, all that kind of stuff. So we keep you going without missing a lot of work. So anyone who's a new patient in practice wants me to look at one of these issues, mention this seminar. We'll give you a free work injury evaluation. We'll talk about any kind of injuries, aches, and pains you might be having. Normally, that's about $150 for an evaluation here. But if you mention this seminar, we'll do it for free for a limited time. Just email, call, or text. We'll get you right in. We answer text 24/7. The phone number is 908-813-8200. You can call the office as well. We have 5 staff here ready to answer. Or email if that's easier, info@hackettstownfamilyclinic.com. Just mention that you did the workplace injury seminar, and the first workplace evaluation will be absolutely no charge. So I will see if there's any questions. And again, that's me, Village Family Clinic. We're at 1500 Route 517 in Alamuch, New Jersey. We're right on Route 517, just a mile off exit 19, Route 80, near Matars, if you know where that is. Again, I'm Dr. Fedich. I'll be your chiropractor, and I presented this to you as well. There's a map there. You see right off Route 80.